All right, well, let's get started. Thank you all for joining us for this webinar today. This is an introduction to the Gateway to Global Aging data, and we're going to be going through a set of internationally harmonized longitudinal surveys and some of the resources that you can use to use these surveys cross-nationally for your own research. A couple notes about GoToWebinar, the webinar hosting service. If at any time during this webinar you have a question, feel free to ask it. Currently, everyone is muted. If you'd like to ask your question using your voice, if your microphone is working, I can unmute you. You can just raise your hand. There's a hand button to raise your hand, and I'll unmute you. Also, you can type a question and pose it as a question through the service, or just type a question in chat. And I'll try to make sure that I'm watching all of those also as we go through this talk. And kind of the goal here is to run maybe an hour and 10 minutes, and then have some time for questions if anyone else has any questions. So let's get started. So as I mentioned, there's this set of internationally harmonized health and retirement studies. All of these studies are publicly funded, at least partially, by the National Institutes of Health here in the US. And so all their data is freely available to use for research. So this set of studies started in 1992 with the Health and Retirement Study. It's conducted out of the University of Michigan here in the US. It's a survey which is conducted every 2 years of Americans aged 50, older than 50, and their spouse. The HRS has been used in many studies. It's a very important study here in the U.S. And so the National Institute of Health, and particularly the National Institute of Aging, wanted to expand this study to other countries, and they'd be able to provide measures of retirement and longevity in different settings, right? So the idea is that you could compare what the retirement process is like, or longevity is like, or life conditions are like, say, between two different countries. Then you can kind of look at some measures of the effect of culture or environment or governmental policy. So the first study to be conducted in a manner which is similar to the HRS, and we call these HRS sister studies, is the Mexican Health and Aging Study. It was started in 2001. It was again conducted in 2003. That was their second wave. Longitudinal surveys are often referred to in waves. So wave 1 is the baseline wave, the initial wave, and wave 2 would be the first follow-up wave. 3 is the second follow-up. So they had their third wave, their second follow-up, in 2012 for IMHAS in Mexico. So they took a 10-year break. Then ELSA started, which is the English Longitudinal Study of Aging. This focused on people living in England aged 50 and older. Again, it's conducted every 2 years, just like the HRS. The survey Health, Aging, and Retirement in Europe is a multi-country survey. So SHARE includes over 20 European countries and Israel. It was started in 2004, and at every wave they've actually added more countries. So it started out, I think initially with around 16 countries, and it's added more at each wave. So SHARE has continued to grow, and there's a lot of cross-country analysis possible just with using SHARE alone. In 2006, CLOSA, the Korean Longitudinal Study on Aging, gave us our first data outside of the US or Europe, covering Asia. And CLOSA had a slightly earlier age range, so they started following people at age 45 or older. So they follow people 45 to end of life. The IFLS was made comparable to the HRS in 2007. That's the Indonesian Family Life Survey, which is actually an earlier survey. It started in 1993, but it was made comparable to the HRS in 2007, and so it's considered part of this family of surveys. Japan was added to the set of data sets in 2007 with JSTAR, the Japanese Study of Aging and Retirement. This follows people aged 50 and older. This is the one study which is not nationally representative. All the other studies do have nationally representative samples, but the J-STAR sample does cover several different municipalities in a way to be able to capture some of the variation inside of Japan. SAGE is the additional multi-country survey that's included in these HRS sister studies, and this is conducted by the World Health Organization. And this includes surveys in China, Ghana, India, Mexico, Russia, and South Africa. So you see you can get a lot more cross-country variation and indeed some variation outside outside of Asia, Europe, and North America in the form of two African countries. In 2010, TILDA was added to this set of international studies in Ireland. That's the Irish Longitudinal Study of Aging, follows people aged 50 and older. Costa Rica was added next, the Costa Rican Longevity and Healthy Aging Study. It was made comparable to the HRS in 2010. They had a follow-up wave in 2012. Costa Rica has particularly a set of oldest of the old, which is very interesting. Then in 2011, the Chinese Health and Retirement Survey started. It's conducted every 2 years. It's a nationally representative panel survey of Chinese peoples aged 45 and older and their spouses. And the Charles sample was drawn from 150 counties in 28 provinces. And then the last study to kind of come online and have data available is the longitudinal aging study in India called LASSI. We had the pilot study for LASSI, which is a kind of a test of the of the survey in 2010, which was conducted in 4 states, and that data is currently available. And then the baseline wave, which will be nationally representative of all of India and also of every Indian state individually, is planned for early next year. So in all these sets of surveys, they are all publicly funded. They're all available freely to use for your research, and they all ask similar questions in similar ways to try to get at some of the things that are happening. You'll notice that most of these surveys roughly follow individuals aged 45 to older. And one of the ideas there is that you want to capture people as they are pre-retirement and then watch them as they move into retirement, so they make that retirement decision and until end of life. So there's a lot of different life transitions, of course, that happen in between pre-retirement and end of life. And these are captured by these studies. So all of these studies have similar core content areas. So those include survey questions on health, cognition, disease, emotion, injury, physical functioning. That includes like ADLs and IADLs, if you're familiar with those. Physical measures and health behaviors, things like drinking and smoking, preventative health behaviors also like doctor visits. And then healthcare utilization also, so whether someone has health insurance, whether that health insurance is provided privately, whether it's provided by the government or is provided by the employer, how much individuals spend on their healthcare, both out of pocket and total spending. And as these surveys all focus around kind of retirement also, so there's there's a set of questions always about someone's labor force status, and that means their employment status, their history of their employment, what kind of job that they worked in, what were the characteristics of those jobs, whether they've been on disability, what were the earnings, what are the wages provided by those jobs, when they decided to retire, and the conditions of that retirement, whether it was something that they wanted to do or something that they felt like they had to do, something they planned for, and then whether someone has pensions and how much they have in their pensions. And all of these surveys were designed with input from economists. So there's a whole host of financial variables, financial survey questions, which include income questions, questions about wealth, and certain questions about consumption, which is sometimes a very important indicator of what we would compare kind of income to income in a developed country. Or questions about earnings, government transfers, so things like how much is paid to people through government Social Security safety nets, disability programs, or other types of government-provided pensions, housing wealth, financial and non-financial assets. And then there's also a set of questions usually which look more at kind of the social environment for these individuals. So these include questions about social network. For instance, how many friends do you have? How often do you interact with them? Family demographics, whether you have children, whether you have living parents, living brothers or sisters, whether there's any family exchange going on. So whether parents are still providing for their children or children are providing for their parents. Marriage questions, questions about marriage happiness, marriage satisfaction, and then social participation. So questions about, do you go to religious services regularly, or do you go to community events regularly, to kind of gauge some of that social interaction that's been shown to have an influence on people's late life outcomes. And you can understand, so these are kind of some general core content areas. And then for each survey inside of itself, there's going to be some differences in these questions just based on the culture and the environment of that country. So there's a couple of key innovations which I'll briefly mention that were used in these surveys. And one is enhancing the quality of economic data. So usually when people report financial data, there's a large number of missings. So if you ask someone, do you currently have a pension? It might be easy for them to answer yes or no, but it might be harder to say, well, how much do you currently have in your pension? And so often people have missing data. And so unfolding bracket questions were incorporated into this, so that when someone says, well, I don't know, then the interviewer then asks, well, is it more or less than a certain number of dollars, right? So is it more or less than $1,000? And if the person says, well, it's more, then you can ask, well, is it more or less than $10,000? And the idea is that you can still include these people in your analysis. You won't have to drop them because of missing data by using imputations. So an imputation is when you assign a value to a value that is missing in a way that will not bias your analysis. So these enfolding brackets are very helpful for imputing data, because then we know a reasonable range with which to impute those values for, and that's really quite helpful. And the second thing is they've integrated biomarkers into social surveys. So those biomarkers include physical measures, blood measures, and genetics. So physical measures are height, weight, waist, blood pressure, grip strength, lung function, gait speed, and balance. And so these are objective measures, which are measured by the interviewer. And these are really nice and important. These studies also include blood collection. So whole blood is collected by Elsa, Tilda, Charles, and Emma. So that's England, Ireland, China, and Mexico. And dried blood spots are collected here in the US through the HRS, in India through LASI, in Germany through SHARE, and in Indonesia through IFLS. And some of the surveys, CLOSA, SHARE for all of the countries besides Germany, and JSTAR haven't currently started to collect blood collection. And one of the kind of the latest fields in research is people wanting to pair, looking at genetics, and in particular, pairing genetics can be quite powerful when you're also able to look at some of the the environmental decisions that people are making, their conditions and their behavioral choices that they're making when paired with genetics. So two studies currently have data that includes the HRS, which takes a saliva sample, so that's for the US, and ELSA for England, which takes a whole blood sample. And both a GWAS is done, which is a type of genetic processing, and those are all made available for the purpose of research. I have one person who just said the sound is not stable. Is anyone else having trouble? If you could just put it in the chat or a question if you're having a little trouble hearing me. I'm not sure whether it's a connection issue on my end or on someone else's end. Okay, it looks like it is sounding okay. Danhee, if you can hear me, you might just want to maybe just try to log off and log on again, and maybe the sound will sound a little better. I apologize. I'll also say that if you have to leave at any point during the webinar, that's absolutely fine. I will make available the slides and the video from this webinar, which will be on our website and on our YouTube page. So if at any time, oh great, your sound is working now, but if at any time it stops working again, you can also watch this later on, or if you missed anything earlier. Perfect. So one of the things that we do here is that we've developed a set of domain-specific user guides, and these user guides look at certain research topics and allow you to compare between different surveys. So say you were interested in looking at cognition, you want to look at cognition in different surveys. We would then allow you to compare cognition. We would give you this user guide, which you can download free of charge, which would tell you what are the cognition questions which are asked in all of these surveys and how are they different. We just have one more question from Yuting, which is, does HRS have data on pain? And I'm not actually familiar with that, but we will look for that shortly, and I believe that they do. So I'll incorporate that in when we get to searching for what questions are available, and we'll look at that shortly. So in addition to these user guides, we've developed this web tool, which we call the Gateway to Global Aging Data. And so this, the Gateway to Global Aging Data includes a digital library of survey content. So those are all those survey questions, for instance, for the HRS questions on pain. We built flowcharts, which show you skip pattern. We built a survey concordance, which is a great searching tool to locate relevant survey items. We built in interactive graphs and charts. The Gateway has integration with Stata if you use Stata, a statistical analysis package, to match survey items to dataset variables. Also, we've built harmonized data files, and these harmonized data files are very user-friendly files to be able to use any of these surveys in a cross-country way. And the harmonized data files don't include all of the variables, like all of the questions that are asked in each original survey, but they focus on those questions which are asked in most of the surveys. And I'll talk about those extensively. And this latest, the latest tool we've kind of built into the Gateway is a searchable library of publications based on health and retirement studies. So if you're doing a literature search and you want to say, well, who else has looked at cognition using SHARE data or using JSTAR data for Japan, you can search that quite easily. I'm just going to go over to our website here, if you can see that. So this is a Gateway to Global Aging Data. It's available at g2aging.org. This is kind of our landing page here, and if we click into Home, we can see kind of our home page, which links you to all the other parts of the survey. And during this webinar today, we're going to kind of walk through some of our main tools, which are categorized here up in the tab. So we'll talk about surveys at a glance, using this concordance to search, graphs and tables, downloading data, creating analysis data sets, and publications, using that publication search. So let's first look at surveys at a glance. So inside of the surveys at a glance here is all of the what we refer to as metadata for a survey. And survey metadata is different than what people generally call survey data, or which we call survey microdata, just to distinguish the two. So survey microdata would be the data set that you download with the respondent values that's available in SAS or Stata, SPSS, or CSV format. So the survey metadata are all of the detailed information about the survey, but not the actual answers. So that includes things like the survey questions and where a survey question is asked inside of the interview. What is that question text? Were there interviewer prompts? What were the type of answers that a person could respond? Do they have a range of continuous values they could select from, or was there a set of choices they could look at? How the question was asked and to whom. So was there a certain respondent who answered that question? For instance, maybe a financial respondent answered for both the respondent and the spouse, things about their housing wealth. we include links to the microdata variables and how the values are formatted. So for instance, if you're looking at a question, which might be called question 26 inside of a survey, we would tell you, that the data that corresponds to that question in the data set that you would download, is stored in like lowercase q25 underscore. That's the variable name with which it's stored, and that can be helpful. We've assigned research topics, keywords, and domains to help you search better. We also suggest similar survey items based on what other users are looking at, and users are allowed to currently make notes. So here on this core interview tab here at Surveys at a Glance, again, you can see all of the surveys that we talked about early, HRS here in the US through the newest survey, which is LASI in India. You can see the HRS started in '92. I find this chart to be helpful because you can also kind of see when surveys came online, because surveys generally refer to their different survey for the different years as waves. So you notice, for instance, if you're interested in looking in 2010, you'd want to look at HRS wave 10, but that would be Charles wave 1. So if you want to compare 2010 in the US and China, you'd want to use those two surveys. So let's just jump into some of the survey data. Let's look at Share Wave 2. So that's the 2006 survey that Share conducted, so their first follow-up. And surveys are generally broken into modules. And a module is just a group of questions usually on the same topic. So you can see Share started out with 2 cover screen modules where they gather basic information here about the household and then about the respondents. They then have a demographics module and a physical health module. One more thing, if I go back to the Surveys at a Glance tab here, we also, we have a couple other tabs. So we have a core interview tab. We also have a study overview tab, this first tab. And this first tab is a good place for you to kind of what I told you earlier about which survey corresponds to which countries and some of the things about when someone becomes age eligible for each survey, whether a spouse is included. This is kind of just a helpful one-page overview of some of the basic ways that these surveys are different. For instance, survey method, number of waves currently collected, and then some of the figures for the numbers that are currently included, like at the latest wave for each survey, the sample size. So that can be a helpful tab if you're ever kind of going back and wondering what's included in a survey. But let's go back to that core interview and let's look at Share Wave 2. And we've got our modules, and let's go into this third module here, this behavioral risk module. So you can see here we've got our module items listed, and these are all the parts of that module. We've got some identifiers up here, and those are indicated by this icon which says ID, just to let you know these are things to identify the respondent. And then we've got these questions here, starting with BR001, and these are identified by this icon with a QU in it. So let's just look at this first question. And this is this next page here is the base level for the metadata. So we let you know that this question BR001, it's included in Share 2006 in the behavioral risk module. We include a brief description, so ever smoke daily. And then we include the question text. And that in this case, it's the following questions are about smoking and drinking alcoholic beverages. Have you ever smoked cigarettes, cigars, cigarillos, or a pipe daily for a period of at least 1 year? So that's the question that was asked. And Share is if you remember, Share is one of our multi-country surveys. So Share is asked in a lot of different countries and a lot of different languages. And so we always include the English translation here on the Gateway to Global Aging data, and not the original data. So it's nice to be able to compare. If you are using a survey in which you are fluent in the language it is offered and that's not English, it's often helpful also to go back to the original language. We let you know that the answer type is enumerated, or that it's a categorical answer type, and those answer choices are yes or no. And in Share, a yes is stored as a 1 and a no is stored as a 5. We let you know that this item is used in a harmonized measure, so that's in a harmonized survey or data set. which again is a very user-friendly data set that this is used in. So you might want to check the harmonized share for this measure. And next we have the associated variable. So inside of the shared data, if you've downloaded the shared data for 2006, the microdata is stored in a variable with a variable name br001 underscore. So this can be quite helpful. You can locate it in a flowchart, which I'll show you shortly. And then we've assigned a couple topics to this. So we assigned the topic smoking and the topic tobacco. And this is helpful because later on I'll show you how to do a search. And let's say you search for something like tobacco. Tobacco isn't, this is essentially a question about tobacco use, but the word tobacco isn't included in this. So we've assigned these topics to kind of provide a more seamless search where maybe you're searching for a term which isn't exactly specified in the question text. We list the concurrent survey items. So this is that same question asked at different years of this survey. So we've got it for 2010, 2012, 2004. And then we say researchers were also interested in. So someone else was interested in this variable who was also interested in looking at self-rated reading skills. So kind of one way to look at survey metadata is what we've done just there, which is if you understand the survey and maybe the module, or if you want to walk through an entire survey, using surveys at a glance, using that tab there can be really helpful. Often though, you might not want to spend your time using surveys at a glance in that way. You might just want to use a concordance, which is a search tool that we have. So with this survey concordance, you can identify comparable survey measures between all health and retirement surveys. You can use that using search by keyword, search by top-level research domain, or for those harmonized studies, those user-friendly data sets which we produce, you can select finer research topics. And this allows you to compare measures between multiple waves of one study or multiple studies. So let's go to the survey concordance next. So you can see here at the top, we have this search bar where we can type in any search terms we might. This is what we call our keyword search. You can then select the study here or the harmonized data set that you're interested in comparing, the years of interest. And then below here, we have these top-level research domains here at the top, so things like demographic, family and social network. And then we've got these finer research topics, which are only available to search for the harmonized surveys. We've also started to add, you can see here with some of these are blue, and so we've added charts to some of these, which you could click on. And these kind of give you an overview of what questions were asked. In this case, this is just the raw variables for each survey. So let's go up and let's Yuting, well, let's look for your question. So let's just type in pain. Let's say we're interested in pain in the HRS, and for instance, let's just look at year 2008. So we can just search here. So you can see, so here are a bunch of questions inside of the HRS which all have the word pain. So it looks like most of these occur in the physical health module. So we have a question here about troubled with pain, degree of pain most of the time, does pain limit activity, whether you have back pain or problems, whether you have pain from shingles. They also have an exit survey, and an exit survey is the survey that is given to kind of the nearest or closest family member once someone has died. So you can get an idea of what the end of someone's life was like. So there are quite a bit of questions around pain. For any of these, you could just jump into this question. So here is this degree of pain question most of the time. So how bad is the pain most of the time? Mild, moderate, or severe is the question that's asked by the HRS. And then you can see that people also can respond don't know or refuse. And this is stored in a variable called LC 015 instead of the HRS data. Let's also look at another example for our concordance. And let's say we're interested in using some of the harmonized data. So let's say we're interested in looking at England and Europe, somewhere in Europe. So we'll use ELSA and share. And you can see as soon as I click these that our years here, certain years are grayed out, and those are years that aren't available. because the survey wasn't yet conducted. So we don't want people to be searching for survey years which aren't possible. So between ELSA and SHARE, the years that are currently available are 2004, 2006, and 2010 to be comparable. So let's look for 2006. And let's go down and let's say self-reported health status. So how does someone report about their health? And then if we search, so what we'll get is, because we're searching these two harmonized data sets, you can see that we've got these measures, which are both from the harmonized ELSA and harmonized SHARE. These are variable names here. And you can see we've got two reports here of self-reported health. One is a European scale, and one is a self-reported health for using a non-European scale, it looks like. And it's wave 2 for SHARE and wave 3 for ELSA, which corresponds to 2006 for both of those surveys. So that's right here. And let's go through kind of one more search, and let's just look for just health in general. Let's type in health in general. We'll use a keyword search here. And let's say we're interested in SHARE and SHARE 2004, and we can search there. So you can see here we've got health in general. We've got quite a few questions for health in general. So on any of these, we could click directly into the item, or we could click on the module. So it looks like most of these here in SHARE, so we've got, it's like 4 different health in general questions. So let's just click into the module for health in general. So here's the module level view, which includes all those questions that we showed you before. And I want to show you 2 other views. So one is the codebook view. And if you're used to looking at survey data and kind of going through a survey codebook, this is kind of the view you're maybe most used to. So for instance, we have health in general question version 1. How would you say your health is? Here are your answer choices. And you can also see there's some pipes and then some italicized things which indicate skip pattern. And skip pattern is really important to surveys because surveys don't ask every question to every respondent. Because for instance, if someone says they don't have any pensions, then there's no need to ask them any questions about pensions, 1 through 10 that they might possibly have. And likewise, if someone hasn't entered into retirement, you don't want to ask them questions about how their retirement is. So skip pattern allows you to allow surveys to be conducted more quickly and with less agitation, both for the interviewer and for the respondent. And so this codebook view is the general way to look at it. But if you scroll down here, you can start to see you have some kind of complicated skip patterns, which are shown in this very linear way. And so sometimes it can be hard because you want to make sure that you always account for a skip pattern when you start to do analysis using any of these variables. Because skip patterns are often used when the answer is already assumed to be known. So let's look at a flowchart view. And this flowchart view is kind of, we wanted to make a visual way to represent the survey skip pattern in a way that's easier to understand in the codebook view. So for instance, we start our physical health module. And the first thing that happens is there's a random number generator here. And respondents either get a value of 1 or a value of 2. So if you get the value of 1, then you're asked this question. Health in general question 1. How would you say your health is? Very good, good, fair, bad, or very bad. If you don't get a 1 and your random number is a 2, so the other half of the sample, they get asked this other question, health in general question version 2. How would you say your health is? Excellent, very good, good, fair, or poor. So you notice that these 2 scales of self-reported health are a little different. And that's because the second scale of self-reported health is a US scale of self-reported health. And the first scale here is a European or World Health Organization self-reported health. And one of the things SHARE wanted to do is to test how these are different, because you'll notice in the US there are basically 3 different levels of feeling good. Right? You can feel excellent, very good, and good. And in the US scale, it's very symmetric, so you can feel very good or good. And so one of the questions is, if I'm looking at this cross-nationally, right? If I'm using a survey who's looking at a self-reported health in the US versus a different, one that uses the European or World Health Organization scale of self-reported health, how do these compare? is feeling very good on this European version, the same thing as feeling very good in the US version, or is it more like feeling excellent on the US version? So this is a place where you might look at one of these variables and notice that half your sample is missing data on this. And then that skip pattern in particular is really helpful, and this flowchart is helpful to let you understand the skip pattern that happened. For all of these flowcharts, you can zoom out so you can get kind of a higher level view. You can also print the entire or any portion of the flowchart that you're interested in. And I'll just scroll down because you can see that some of the skip patterns get quite complicated. They can be especially complicated later. Skip patterns also occur between waves. So for instance, someone might have a skip pattern based on what you answered in the first wave in your baseline. It would change how what the survey looked like for you in the second one. And you'll notice at the end of this module, you get asked, you have these two other questions, which is looks like you get asked, let's see, if your random number was a 2 instead of a 1 initially, then you get asked that US version, which you didn't get asked the first time. And the other half of the sample that answered the US version, now gets asked the European version. And so Cher also wanted to test this one other thing, which is how does when someone answers this question in the module affect people's answer? Because one of the findings that's been consistent has been that if you ask someone at the beginning of a survey how their health is, someone might say, oh, it's good or it's fine. In this case, fair, right? But then if you ask someone a set of questions saying, well, have you had any falls? Do you have any aches and pains? Have you been to the doctor? By the end, you ask someone, you spend 30 minutes going over someone's health over the last 2 years or over their lifetime. By the end of that module, often if you ask them how their health is, they say that it's not quite as good as they would have said initially. So Cher wanted also to be able to measure what's the effect of where this was asked inside of the survey. So even though you might select one of these variables, and you might say, well, it looks like I'm missing this data for the other half of the question. It's not that you're missing the data, it's that it was asked in a different question to the other set. So understanding skip pattern is extremely important. I'll show you one other example of a very common skip pattern. And this is a skip pattern where the answer is already assumed to be known, which you want to account for. So this is a skip pattern about someone's ever smoked daily. So the first question is, have you ever smoked daily? And then if you answer yes, the next question you're asked is, do you smoke at the present time? Right? And so if you're trying to make a measure of do you smoke at the present time, you want to make sure that you account for this skip pattern, because you can assume that anyone who had never smoked is also not smoking at the present time. We also built interactive graphs and charts, and we wanted to build graphs and charts to give users a way to interact with the data before actually downloading the data and going through kind of sometimes the difficult process of weighting the survey data, of doing things like accounting for a skip pattern. So what we have is a select number of measures which you can go ahead and compare using our graphs and tables here between different surveys. So you can see we've got a select measure of demographic, healthcare, health, cognition, employment, income, assets, and family measures, which you can compare between different countries. And we allow you to filter for specific ages, or you can filter by gender. So let's go through and let's go to our graphs tab, which is our third tab over, our third tool that we have here. So you can see as soon as we look at this, we get this graph that pops up, which kind of preloads here. And this is whether you are currently working for pay. And here we're comparing China, Germany, Japan, England, and the US. And we've kind of subset this by only people who are aged 55 to 64. And because we're mostly dealing here with nationally representative samples, and we've applied the survey weight, so these are actually population estimates, not just estimates from our sample. And you can see here that we have quite a bit of cross-country variation of people aged 55 to 64 who we might expect to still be working who are still working. So in Germany, we have 73% of people who are still working in this age range, which is very close to Japan here. It's almost 72%. But in China, it's much lower at 56%, and England and the US, it's 61 and 62, are somewhere right in between. And so let's generate a few more of these graphs. So let's say we're interested in looking at England, the US, Japan, and Italy. And we'll look at the year 2006. And so we can go through all these measures. In this case, let's look at ever smokes. And we can take off our filter of age. We'll look at all ages of these surveys. So if we scroll up, we can see immediately the a table here, our graph here, which represents the proportion of the population which has said they've ever smoked. So in England and the U.S., it's quite similar and high. It's 62% and 57% for the U.S. who said they ever smoked, and it's actually much lower for Italy and Japan at 42% and 44%. And the first time I looked at this seems surprising to me. I mean, my conception of Italy and Japan even is that people smoke much more often than they do here in the U.S. So this surprised me. So one of the things that we might want to look at is, instead of ever smokes, we could select smokes now, so people who are currently smoking. So let's generate that graph. And there you actually kind of see the opposite effect. So we can see that Italy and Japan, have above 17% people who report currently smoking in these age ranges. And in the English and US, it's 15% and below for people who currently smoked. So it seems like while more people in the US in these age ranges have ever smoked, so they have smoked at one time in their life, there's less people smoking currently, which seems more it seems more believable to me. For any of these graphs, you can download the image file automatically. So you can download PNG, JPEG, PDF, or SVG image file. And then we also provide tables for exactly the same thing the graph provides. And the tables are nice because it gives you a little more information. For instance, we'll give you standard errors and the ends. We'll also give you any counts for missing. So if some people didn't answer that question, we'll let you know how many people didn't answer it. So in this case, you can see quite a number of people in Japan actually didn't answer this question, while very few people in England did not answer this question. And these tables can be downloaded in CSV or PDF format. We also have notes which let you know how this weighted. And in this case, we're looking at smoking, which is an individual activity. So these are all weighted using respondent level cross-sectional weights. And then we also link back to where in the Harmonized survey any of these survey measures come from. So let's look. Let's go back to our graph, and let's look at just at England. So if we look just at England, and we can still look in 2006. If you're looking at one country, we also allow you to look across subpopulations. So let's say that we're interested in seeing whether the effect was gendered. So we can look across gender for ever smokes. And you can see that males in England in this age range are much more likely to have smoked. So 70% of males are more likely to report having smoked, and only 55% of females. But then if you look at currently smoked now, as opposed to ever smoked, you can see that the difference in currently smoking seems to be much less gendered, right? They seem almost par for par, males and females, in the age range that ELSA looks at, which are currently smoking. And also, just like you can compare gender, you can also compare age. So we'll let you look at different age groups. So for instance, if you look at currently smoking across different age groups, so we have ages 55 to 64, 65 to 74, and 75 to 84, you can see that it does seem that there's a higher percentage of the population who are younger, who are currently smoking in England, which is interesting. So those are our graphs and tables that we've built in. I'll show you a couple other ones. This is that initial graph that we looked at, which is currently working for pay, and I've just added in two two other countries here just to show you some extremes, which is we've added Slovenia and Sweden. So you can see that in Slovenia, we've got less than 25% of the population aged 55 to 64 is currently working for pay, and in Sweden, it's over 75%. And Slovenia and Sweden are both from share, so we know that this question is asked in exactly the same way. So you get a lot of interesting cross-country variation, which you can then start to look at. So what are the other things that are going on in Slovenia and Sweden, which might encourage people in Sweden to be working still at in this age range that in a way that people in Slovenia are often not working in this age range. I also showed you before that we have a number of financial measures we allow you to graph, so income and wealth. So here is total family income, and this is for England in 2004, and we look, in this case, over 3 age groups, as we did before with smoking now. And so these are histograms, overlapping histograms. So you can see that here the blue line is our youngest group, and the green line is our oldest group. And so you can see the distribution of income changes for these different age groups, which is what you would expect as people move, from before retirement, which we would assume to be more income or wage-based income, into retirement when your income distribution would look different. And I'll show you one last table, which is comparing something you can also compare between multiple waves of one survey. So this is looking at the net value of primary residence in the US between 2000 and 2010. And this is interesting because both using the median and the weighted mean here, we can see that people's their housing wealth continued to increase 2002, 2004, 2006. In 2008, it stayed really right around 2006 levels, and then by 2010, you can see that it's like 2000 levels. People have lost their housing wealth. They've lost everything they've accumulated in the last 10 years, often in their housing wealth. You can also see that the 25th percentile here is actually 0, and that's because a lot of people's houses went what they call underwater, which is to say that they owed more on their house than they currently had in value. So the HRS, in this chart, you're able to really see the effect of the Great Recession in the U.S. and how that affected people in retirement. And there's been some analysis done looking at these people who lost a really large share of their wealth and the effect that they had on their retirement decisions and their end-of-life outcomes here in the U.S. So everything that we've looked at so far does not require you to be registered to use this site, but we do encourage you to register, and everything that we will look at from here on will actually require you to be registered. And registration is very simple. You can just click on register here at the top right. You'll just provide your name, your country, the institution you're affiliated with, and just let us know why you're registering. We just have a couple options here. Again, everything is free of charge. And once you register, we'll send you an email just to confirm your email. And that's all registration takes. I'm going to log in here so we can look at what it looks like for a registered user here with an example profile, and her name is Jane. So we can see that as soon as we register, I get this box here which says your item cart is empty. And so let's talk about what an item cart is. It looks like if we click on it, you can see we've got our cart is currently empty. So what does that mean? So once you're registered, so one of the things we allow you to do is to integrate with data. And so the idea is that you would use the, let's say you have the HRS data and you have it stored on your computer. Then you could then use the Gateway to Global Aging data, for instance, to search for variables about pain, right? And so which questions are asked about pain. And because we record the names of those variables as stored in the HRS data sets that you would download, we could then produce a Stata program for you. And a Stata program is often called a do file because Stata programs end in .do to produce a data set which only has those variables which are specific to your interest. And you do this through the data options page. So the data options page is always accessible once you're signed in here, right below your item cart. So we can click on data options. And in the data options, you can see that here on the left, I've listed the folder location for data that I have stored on this computer here. So I've got for ELSA 2002 data, I've got it stored in C drive, ELSA data, a folder called ELSA data, and a folder called 2002. And I can add any other data set location. So if I get a new set of data, let's say I get ELSA 2006 data, then I can say, hey, I have this data downloaded. I'm going to store it in a folder. I've stored it in a folder called ELSA 2006. And this time, so once I've added that location, then anytime that this data program is generated for me by the gateway, it knows exactly where that data is on my computer, which removes one step that has to be taken care of. But let's say that I don't have the ELSA data yet, and I want to obtain the ELSA data. I want to download it. So here on our download tab, which is our fourth tab here, we've got links to download survey data. That's that first row. And this is one of the most helpful things that we do is we link to where you register to download any of this data. And as I said, all this data is publicly, these surveys are publicly funded, and this data is freely available for research. Each of these is going to require you to submit to a different registration process, a slightly different one. But in general, as long as you're using it for research and not for commercial purposes, you should get approved in a couple of days and you'll have access to that data. Also, I will tell you the LASI data, the India survey data, can be downloaded directly from our website. And that's because we are one of the organizing partners for LASI, so we actually distribute the LASI data for India ourselves. On this downloads page also, briefly while I'm here, you can also download the harmonized data sets, which I'll talk about shortly. We allow you to download the code that was used to produce the harmonized data set, harmonized code books, so documentation. We have here links to the RAND working paper series on cross-country comparability. So for instance, if you're interested in cognition, you can compare cognition between different countries by just downloading this working paper. We also include helpful documents, and then we have our recent presentations. This is this last box. And this is the box where if you're interested in these slides after the talk, we'll upload them here, as well as the video. We'll include a link to YouTube for the video for this webinar as soon as this is over. So let's say now that I've got my ELSA data, so I can go back to our cart, and then let's say that I wanna put some items together in my cart. So the easiest way to show you how to do this is let's just let's create some analysis data. So you can do that by searching for relevant survey items, by browsing for surveys, as we've done using the Surveys at a Glance tab. You can search using the Concordance. We also have some predefined carts. So let's look at an example. So say we want to compare whether health limits any paid work in 2006 between the US and England. This is what I'm interested in for my analysis. So we're going to select variables from the HRS for the US and for ELSA for England. I'm going to make sure that I've listed the file locations for all these variables. I'm going to create a cart and add any other relevant variables. And then I'm going to have the Gateway website generate a do file for me, this data program, which is going to create one data set for me with information from only these two studies. So let's go back here and let's go to our Concordance tab. So we're going to search for, we'll use just a keyword search. We'll look for health limits paid work, and again we're going to compare the HRS and ELSA, and we're looking in year 2006. And we can search here. So you can see immediately we get this list of questions. And so we get this question from ELSA, which is whether health limits paid work. This is exactly the question I'm looking for. And you notice since we're signed in now on my search page, I get two more columns, and one is in cart, question mark, and one is status. And it looks like I've got a check mark status here. And what this means is that I've already indicated that I have this data, and I've told the gateway where this data is on my machine. If you have an X here, it just means that you don't have the data currently available, or you haven't included in your user profile on that data options page where you store the data. So let's add this to my cart. So our data cart is going to be where we're going to store similar items that we're interested in. You can see as soon as I click on that, I've got one item in my cart here. And then for the HRS, we've also got this question, whether health affects paid work. This looks ideal. So let's add that to my cart also in KM002. And then if we look at our cart, you can see I've got these two questions. I've got two check marks here saying that I've indicated the location of this data set. At any time, you can save a cart. So say if we could call this HRS ELSA health limits paid work. So I can save this, and as soon as I've saved it, I can come back to this anytime. So if I want to look at something else later on, that's absolutely fine. And I've also got some other saved carts which might be applicable here. So I've got this ELSA 2006 basic demographic carts that I made before. So let's add this into our current cart. We can do that with append to cart. So you can see there I've added gender and year of birth from ELSA. And I've also got a similar cart for the HRS. So let's add that in. I can then select all and say create.do file. And immediately what's going to happen is the gateway is going to download a do file for me. You can open it directly with Stata, or in this case, let's just open it with WordPad, and let's just look at what it is instead of running it in Stata. So you can see here that we've got, this is what a Stata program looks like if you're not familiar. This is a .do file. So you can see first we use the ELSA data, and because we previously told told the gateway that my ELSA data is stored on my C drive in a folder called ELSA 2006. It also knows the name of this data set. These are the variables we're going to keep. You can see a couple extra variables, and these are we always keep unique identifiers. So we have that here. We then append with the HRS data and keep those important files, and then append with another HRS data file and keep those files. And so if we ran this in Stata, our result would be this data set that we have here. So you can see we've got the HRS data here in the top left, and we've got the ELSA data here in the bottom right. Kind of the variables of most important interest here are KM002 for the HRS, and it looks like we have 1s and 5s, so that's probably a yes and a no here for the HRS. And we've got our HELWK from ELSA, and it also looks like it has value labels applied here. So we've got some no's and yeses, also some not applicables or don't knows, and we don't know exactly how those are stored. So while we do have everything we want in one data set, there's still some work to be done, right? We want to make sure that these two variables are formatted the same way if we're going to compare these, and we probably want to put them in the same column also. And we want to account for any skip patterns that might have happened. So if there's any variables, if there are any skip patterns which decided whether you were asked this question, we want to account for those if we can reasonably assign a value for people who weren't asked that question. And so this brings us to harmonized data files, and this is what I'll talk about for the rest of this webinar. So harmonized data sets are created to provide harmonized measures of international aging and retirement surveys. Harmonized data sets define variables as similarly as possible to the RAND HRS definition of a variable. And if you're not familiar with the RAND HRS, the HRS data here in the United States, the version of the data that people almost always use is the RAND HRS, which is this very user-friendly, very cleaned version of the HRS data that has just been wildly popular here in the US. And it's called the RAND HRS because it's been conducted. This data product is put out by the RAND Corporation. So what we do in our harmonized data sets is we make a harmonized data set like a harmonized ELSA or harmonized share, where we try to define a variable as similarly as possible to the RAND HRS. So like the RAND HRS, all of our harmonized data sets are in FAT format, where every record represents one individual. Variable names use a really easy to understand variable naming convention from the RAND HRS, which is a variable like with a variable name R1 work, is whether the respondent, so that's R, is currently work in wave 1. And then the wave 2 value would be stored in a variable called R2 work. our variable names also indicate how similar to the RANDHRS version of the variable is in the harmonized share. So for instance, if this question about whether the respondent is currently working is exactly similar in the harmonized share, then it would have exactly the same variable name, R1 work. But for instance, if share asked this question in a pretty significantly different way, we might call that variable name R1 work underscore S to indicate that it captures the same item, but in a way that's very specific to share. And so you might want to do a little extra work to indicate whether it's really harmonizable between different countries. And then we also include spouse versions of most of our variables. So all of the surveys, with the exception of JSTAR, interview the respondent and the spouse. So they're both really respondents, but we allow you, we go ahead and match up spouses and respondents so that if you want to look at the spouse values without doing matching by household or by couple ID, right there in the respondent record is also the spouse value. So if you want to look at family effects, it makes this much easier to look at something like a family effect. So the harmonized data files that we currently have available are the harmonized ELSA, which is the first 5 waves of ELSA, the harmonized share, which is the first, second, and fourth wave of share, the harmonized JSTAR, which is the first 3 waves of JSTAR, the harmonized CLOSA, which is the first 4 waves of CLOSA, the harmonized LASSI, which it currently is just the pilot data of LASSI, because that the baseline will go into the field early next year. The harmonized Charles, which incorporates the first 2 waves of Charles, so 2000 and 2012. The harmonized IMHAS, the harmonized Corellis, and the harmonized Tilde are all currently being developed. And every time that a new wave of data is released, we update also the harmonized data set as soon as possible. So we're always constantly updating these data sets. And harmonized data sets are distributed either through our website, through the gateway here, or by the originating study. So in the case of the harmonized ELSA, when you download the ELSA data, you also get a file called the harmonized ELSA data. So it's if you have the ELSA data downloaded, you already have the harmonized ELSA downloaded. In some cases, like the case of the harmonized share, the file is created by code that we provide based on the gateway. So if we go to our downloads tab, you can see here we've got this create harmonized data, and we provide here the code to generate any of these data sets from the original data. So for instance, from the harmonized share, as long as you have the share data, and we let you know, to make sure to have the newest release of the shared data, you can just download this data creation code, and if you run it once, it will create the harmonized share on your computer, and you can just save that and refer to that for any future research. And this data code is also helpful because if you want to see exactly how we did something in Stata, it can be quite helpful. So let's look through just a simple example of what harmonization is and why it might be helpful to use a harmonized data set. So for instance, let's say we want to create an indicator of whether the respondent currently smokes. So in the harmonized share, we would call that R for respondent. We're going to look at 2004, so it's wave 1 of share, smoke in, whether the respondent smokes now. And inside of share, this question is asked with a skip pattern, like we saw earlier. So first a question of ever smoke daily, and then a question of smoke at the present time. And we've accounted for this skip pattern inside of in the creation of this variable in our harmonized share R1 smoke in. So you can see that ever smoke daily, if you said you didn't smoke daily, or you said you smoke daily but you don't smoke at the present time, you've stopped smoking, then you're assigned a value of 0 for no in our harmonized variable. And if you said that you do smoke at the present time, then you're assigned a value of 1. All harmonized values are the same between all data sets, so a no is always stored as a 0, and a yes is always stored as a 1. So we've taken out some of those country differences that can cause problems. So this is an example of a really simple version, right? This is just a one-step skip pattern to create this harmonized variable. which might save you like a little bit of time if you're comparing two different countries. But it's not going to save you a lot of time. But this is like the simplest example, and so I'd like to also show you a complicated example. And I'm not going to walk through this in the same detail, but this is the skip pattern in which JSTAR in 2007 asks about how much wealth people have in savings accounts. And JSTAR uses actually two different surveys. So they first use a self-completion survey, which is sent to the respondent before the interview actually comes to their house. And then once they fill that out and an interviewer comes to their house, that changes the questions the interviewer asks. So you can see there's a lot of different ways that people can be asked this question. If the person says that they and their spouse don't have this value, so this is a household level value, which is both the respondent and spouse together. So if someone doesn't have this value, they're assigned a 0 value, or they're assigned the value of the two people together. And then you can see we have this blue bracket and dotted line, which is to say that we also provide imputations here. So in the case of the person says they do have a savings account, but they don't know the amount, we then use those unfolding bracket questions that I mentioned in the innovations at the beginning to impute the amount. So we assign an amount to each respondent, and we flag whether we've assigned it or not, and whether we've assigned it based on a bracket of we know that it was more than 10,000 yen, but less than 20,000 yen, or if we don't know anything about it. And for all of this, we provide a lot of documentation. So each harmonized data set is accompanied by its own codebook. And the codebook includes a brief overview of statistics for each variable. It details variable creation and assumptions made in that creation. We want to be really transparent and clear about what we've done because we're making sometimes some complicated decisions, which if you're going to use this variable for your research, it's very important. And in an example like for the harmonized JSTAR, here we have a value of savings, and we've accounted for this complicated skip pattern. We've performed imputation, so you can still include all those respondents who didn't answer the question in your analysis, which is important to do so that you can produce nationally representative results. But this value and savings account is only one part of wealth, of a wealth portfolio. And let's say that you're not an economist and you're not interested in how much someone has in housing wealth versus a savings account wealth versus pension wealth. Let's say you're interested perhaps in volunteerism, and you just think that volunteerism might be different for people at different wealths, that you might want to account for wealth, just total family wealth. So you would have to build this before you did your analysis piece by piece from each of these questions, which is months and months of work for a full-time programmer. And so what we've done here is we've provided kind of all these things for you using full-time programmers and advice from economists about how to do this correctly. And we've documented all those decisions for you. So you can really focus on those parts of your analysis which are most important to you, and use these kind of expertly defined variables for things that might not be as important. So we highlight in our codebooks, we highlight any differences between harmonized variables and other harmonized variables, so difference between this variable and a variable in another harmonized data set. And then we list all the variables from the originating data set used in the creation. And this can be helpful because let's say that you disagree with how we combine or create a harmonized variable. We give you all of the raw variables that were used so that you could create it yourself. So let's look at what a harmonized codebook looks like. These can be downloaded. Any of these codebooks can be downloaded from our downloads page. You can see here in this fourth row, we allow you to download harmonized codebooks. These are PDFs which are freely available for you to use with all of our documentation. So this is that smoking question from Share that we walked through before. So you can see we produce for all three waves that we have of Share, we produce two variables, which is smoke ever or smoke now. And we have both respondent and spouse level variables. We include some brief descriptive statistics to get you an idea of how the data are distributed inside of the data set. One note that these aren't population statistics because they're not weighted. They're just for the data set. Because this is a categorical variable, we provide frequencies also. So you can see that, again, always a no is stored as a 0 and a yes is stored as a 1. You can see these counts. And then we've also assigned different kinds of special missing values, which are used in share and Stata. So this is a missing value, but it's a missing value with a little bit of extra information. So for instance, it can be missing because someone refused or because someone didn't know the answer. And you might want to treat those differently in your analysis. So we flag those differently. We then have this how constructed text. So we walk you piece by piece through how this variable was constructed, what the skip pattern was that we accounted for, what each variable means, that a 0 is a yes and a 1 is a no, what these variables .d, .n, .r might mean. We highlight any crosswave differences. So if this, if this question changed in different waves of share, we would highlight that for you here because these are longitudinal surveys. So you really want to know make sure you're comparing different waves. You're comparing the same thing. And then we highlight differences with the RAIN-HRS. So in this case, in the share, respondents are asked whether they have ever smoked daily for a period of at least 1 year. And in the HRS, respondents are asked whether they've ever smoked, regardless of whether the smoking was daily, and not given a definitive period. And depending on what you're looking at, that difference could be quite important. So we really try to highlight those differences for you here. And then the last thing we do is we list these raw variables used. So you can see for all three waves of share here, we have the raw variables that were used. And then I'll just really briefly run through our example from the Harmonized JSTAR, our complicated example. So you can see that we create the value of savings, and we also create a flag variable. So this flag variable lets you know whether this value was created from what we call a continuous value, which is a reported value, or a 0 value was assigned because the person said they didn't have the asset, or the value was imputed because we were just missing the values. This is based on a complete bracket where we know it was more than 10,000 yen but less than 20,000 yen, an incomplete bracket where let's say we knew it was more than 40,000 yen but we only know one side of that bracket, or whether we didn't have any information about the bracket. And then you can see our how constructed text here is much more complicated because it's a much more complicated creation. And then we list all those variables used. So these harmonized codebooks are really helpful and really powerful. They're very user-friendly. It's really the best way to start comparing things between different countries and to be able to integrate really complicated measures into your analysis, which you might not have the time to make yourself, looking at things like income or wealth or cognition or something like activities of daily living count. Things like going through someone's marriage history and knowing the number of marriages that they've had. So let's go back to that kind of example analysis and let's look at what if we did this with using harmonized data instead. So let's say we want to still compare whether health limits any paid work in 2006 between the US and England. And so let's compare, we're going to use the RAIN-HRS and the harmonized ELSA, so these harmonized data sets. So we know that they're going to have similarly named conventions, and if we download a do file, the result is going to be one data set with easily comparable and similarly named measures from the two studies. So if we did that, what our data set would look like is this. So you can see here on the far right, we have this variable called R, and in this case, we used 06 for year 2006 health limits work. And you can see all our values are formatted the same way. So it's always a 0 for a no or 1 for a yes. And we could immediately start doing cross-country analysis here to look at maybe what are some of the other factors that are different. But we've accounted for that skip pattern in this case, and we've also we've made sure that our values are formatted the same way between different waves. So we've cut a lot of the steps out for you. The last thing I will briefly mention as we write up is our newest feature, which is a literature search. So users can find publications based on health and retirement surveys around the world, which are relevant to their research focus. You can select from survey, topic, or year. You can search by title author, or source. So this is our last tab here, which is publications based on surveys. So if you click on this, you can select, as I mentioned, by survey. So let's say you were interested in looking at MHAS. So you're looking at, you want to look at surveys or research which has come out, which used MHAS data. And let's say, particularly maybe you were interested in health in MHAS, you could select health. And you can see here a set of papers which look just at this. You can also, instead of using a topic, you could search by a keyword for a title. You could say something like, let's see, like well-being. So you can look at papers that look at well-being in MHAS, which can be quite helpful. You can also search, if we click off of MHAS here, you could also search by author. So if there's an author you're looking for instance, Eileen Crimmins here is a researcher who has used a lot of these surveys here at the University of Southern California. So you can get her papers. And for any of these papers, you can click on them. You can get links to the paper if it's available directly online. We include a direct link. Or you can get a link to Google Scholar, which can be helpful to kind of point you in the right direction for how to access the journal, and it'll give you an abstract immediately. And let's say if you selected multiple citations, here at the bottom, we allow you to export them, and you can export them as a text, CSV, or EndNote file. So we kind of wanted to give you a way to find, to do a literature search, where you really are able to tell where has the data that these people have published on, where has it come from, to make sure that, if you're interested in looking at cognition in Japan, we can help you isolate a set of studies which have already been published using JSTAR data looking at cognition, and that can be really helpful. So we've gotten a lot of great feedback about this feature, which we just released this year. We also maintain a help desk. You can use this help tab here. And this help desk you can access by just sending us an email. So it's help@g2aging.org. We always try to answer within 24 hours during the work week. We have a small team here, but we're quite hardworking. So we always try to get back to you. We filter your question out to the right person. And these could be questions, let's say something isn't working on the site, you can let us know and we'll get back to you quite quickly. Or it can be a question like, hey, I'm interested in studying cognition. Can you let me know, what are some of the resources that I can use for cognition, and what are the countries that might be of interest? And then I could point you to that working paper on cognition between different surveys and help you out with that. So that wraps up our webinar for today. Thank you all for joining us. If you have any questions, please answer it now. It looks like we have one question, which this website is funded by NIA, by Tu Chen, and AS is absolutely correct. This website is funded by the NIA. We're very grateful for their funding, and we hope to be able to continue to offer this resource, freely available for our research. So if anyone else has questions, feel free to raise your hand and I can unmute you to ask a question, or you can just type a question in the chat. I'll also briefly just mention that in January, coming up, we'll have an advanced webinar where we go through how to do cross-country analysis, and we talk more about things like weighting, accounting for survey design between different countries, all using Stata. So I encourage you to sign up for that. And you'll get an email also about an hour after this survey is done, which asks you, after this interview is done, this webinar is done, where you can fill out a survey just to give me feedback whether you enjoyed this webinar, or if there's things that we could improve for you, which we always appreciate your feedback. And then a link to register for that next webinar to actually be able to do some of the cross-country analysis. So if you don't mind filling that out, that would be appreciated. We've got one more question here, is how do we cite data we use from the website? So in the case of most of the data you would use from the website would be from the harmonized data sets. And inside of each of the RAN-HRS harmonized code books, if we have, I think on the second page, there's a little thing that we ask you to say, which is that you use data from this harmonized code book, as paid for by the National Institute of Aging and our grant numbers. So we would ask, yeah, any research that you do that gets published, we would appreciate you citing that you use this research. And also, when you register, we'll ask you to just let us know if you publish using any data from our website, so we can keep track of that, so we can make sure that we can continue to get funded to offer research like this. All right, I'll hang out for maybe 5 more minutes if anyone else has any questions.